Hey guys, Dr. Andy here. Today we are going to talk about shoulder pain in our golfers and our tennis players. And so this is actually a rotational athlete. Now there are other sports with rotation as well, think baseball, right? But for now, let's just talk about our tennis and our golfers, okay? So whenever we develop shoulder pain, it's very, very important to understand if this is a mobility problem or a instability problem. A mobility problem just means simply that the shoulder is not moving as well as it is supposed to. There is a loss of good range of motion, okay? And if it is a instability problem, it means that, well, it can actually move just fine. It's just that you can't control the movement because everything's too weak and there's bad motor control, okay? Both of those scenarios, you are going to have and develop pain in the shoulder if you're a tennis player and you're a golfer. And the more you play, the worse the problem is going to get. So the most important thing to do is to decide and diagnose appropriately which type of a problem it is. Because if it's an instability problem and I work all day long on trying to increase range of motion, thinking it's a mobility problem, the problem is just going to stay there and it's just going to keep coming back and it's never going to get any better and you're just going to be really unhappy with me, right? So the very first thing we have to do is we do a really good movement assessment and challenge the shoulder and the muscles and the joints, all of the joints involved, to make sure if it is a mobility problem or an instability problem. And if it's a mobility problem, meaning that the shoulder and the whole complex, the whole shoulder girdle is not moving as well as it is supposed to, we need to figure out which muscles, what joints are causing that problem, okay? Number one, a lot of times we have lost a lot of good mobility in the mid-back. Many times my patients are coming in with shoulder problems and sometimes we don't even have to touch the shoulder. If we can actually find some restrictions and some loss of mobility through the mid-back, get this area moving a whole lot better, it takes away their shoulder pain and we never even touch the shoulder. Kind of cool, right? So first and foremost, we're going to check and work on the mobility through the mid-back. Obviously, we're going to work on the mobility and through the shoulder with the muscles and the actual glenohumeral joint itself, okay? Also, neck highly involved, all right? And we're going to do that through spinal manipulative therapy, right? So the chiropractic adjustment. Manual therapy, like getting in there and working on the muscles like a really good massage. Dry needling will help quite a bit, as well as other types of stretching, okay? So if it's a mobility problem, that's our approach to shoulder pain in rotational athletes. If it is a instability problem, meaning you have lost stability, the shoulder cannot control the movement appropriately, you're still going to develop pain in the shoulder. And guess what? A lot of times it still might have a mid-back thoracic spine component. So we're going to check the mid-back and work on the mid-back in here. On top of that, our main approach is going to be rehab and exercise. So you've seen some of my other videos where we kind of show you crossover symmetry. Awesome exercise for rotator cuff problems, okay, and getting some stability through those muscles, okay? So we are going to focus, and Mr. Connor is going to focus a lot on strengthening and stabilizing the entire shoulder girdle to increase your stability. And when we do that, we notice a huge improvement in your pain. All right? So if you're a golfer, if you're a tennis player, and you have shoulder pain, these are the things to kind of keep in mind. Is it a stability problem? Is it a mobility problem? And if you're not sure, and some of the approaches that you're not doing at home aren't really working to solve the problem, give us a call, come on in, we'll help you out. Hopefully you found this information useful, and always remember to live with passion and not pain.